Cardiovascular activity is affected by many humoral factors to adapt to the metabolic need. What humoral factors affect it? Both adrenaline and noradrenaline belong to catecholamine, with only one methyl in difference. Do they have the same effect? To settle these questions, we'll learn the humoral regulation on cardiovascular activity. Introduce renin, angiotensin, aldosterone system first. Renin is secreted by renal juxtaglomerular cells. It can hydrolyze angiotensin produced by liver into angiotensin 1, which is converted to angiotensin 2 by enzyme. Angiotensin 2 is further hydrolyzed to angiotensin 3 by aminopeptidase. Both angiotensin 2 and 3 can stimulate the release of aldosterone from adrenal cortex. This is a chain reaction, so it's called renin, angiotensin, aldosterone system, short for RAAS. In cardiovascular system, angiotensin 2 and angiotensin 3 can contract blood vessels and increase blood pressure. Angiotensin 2 has strong effects on vessels. It can contract small artery and arterioles, increasing peripheral resistance, contract the vein, increasing venous return. It binds with the receptor on the sympathetic ends, promoting the release of noradrenaline. It acts on central nervous system, reducing the sensitivity of viral reflex. It also promotes the release of vasopressin and oxytocin. It can lead to thirst. Together with angiotensin 3, promote the release of aldosterone. Aldosterone increases the reabsorption of sodium and water by renal tubules so as to increase circulating volume. All of these contribute to the rise of blood pressure. The vasoconstrictive effect of angiotensin 3 was only 10 to 20% of angiotensin 2, but the effect of promoting aldosterone was stronger. One type of antihypertension drugs is IAS inhibitor, angiotensin converting enzyme inhibitor such as captopril, angiotensin 2 receptor blocker such as losartan, renin inhibitor such as ramipril. The second is adrenaline and noradrenaline. Adrenal medulla can release adrenaline, accounting for 80%, and noradrenaline, accounting for 20%. A small part of noradrenaline comes from sympathetic nerve. Both adrenaline and noradrenaline belong to catecholamine, with only one methyl in difference. Do they have the same effect? No, they have different effects due to the different affinity with receptors. Adrenaline can bind with alpha and beta receptors. In heart, adrenaline binding with beta-Y receptor can increase cardiac activity. In blood vessels, adrenaline can cause the contraction of vessels in skin, kidney, and gastrointestinal tract, where alpha receptor is dominant. and the relaxation of vessels in skeletal muscle and liver, where B2 receptor is dominant. Some vessels contract, some vessels relax, so the peripheral resistance changes little. Adrenaline is mainly used to strengthen the activity of heart in clinic, so it's called cardiac stimulant. Noradrenaline mainly binds with alpha and beta-1 receptor, but has a weak affinity with B2 receptor. When noradrenaline in blood increases, it binds with alpha receptor. Almost all the vessels contract, so the arterial pressure increases significantly. However, the increase of arterial pressure can slow down heart rate through barrier reflex, which overcomes the direct effect on the heart. Noradrenaline can significantly increase blood pressure and slow down heart rate. In clinic, it's called pressure agent, being used in shock treating. The third is vasopressin. It's synthesized by supraortic nucleus and periventricular nucleus in hypothalamus, and transported to posterior pituitary gland to store and release. Vasopressin binds with V2 receptor in renal collecting ducts, promoting the reabsorption of water. Therefore, it's also called antidiuretic hormone. Vasopressin binds with V1 receptor in vascular smooth muscle, causing vasoconstriction and the increased blood pressure. At physiological dose, vasopressin appears antidiuretic effect. When its concentration increased significantly, blood pressure increased. If the afferent nerve of barrier reflex were cut off, vasopressin with low concentration can cause vasoconstriction. The reason is that vasopressin can increase the sensitivity of barrier reflex. Endothelial cells of blood vessels can synthesize and release vasoactive substances. Vasodilators include nitric oxide, prostacyclin, and endothelial hyperpolarizing factor. Vasoconstrictors include insulin. Atrial natriuretic peptide is secreted by atrial myocyte. It mainly acts on the kidney, inhibits the reabsorption of sodium, therefore shows a strong diuretic effect. It's also a vasodilator. Next, let's do a summary. There are many humoral factors affecting cardiovascular activity. We should grasp the effect of RAAS, adrenaline, and noradrenaline. Hypertension is a common disease. There's a series of antihypertension drugs targeting RAAS, including angiotensin-converting enzyme inhibitor, angiotensin II receptor blocker, and renin inhibitor. Adrenaline is called cardiac stimulant, which can be used in heart failure. Noradrenaline, known as pressure agent, can be used in the rescue of shock. That's all for this class. Goodbye.